You don't need 4 drinks to have the same benefit. You might just take 2 drinks and go, I'm there. I don't need to have more. And you might say, matter of fact, I don't need anything.
So in today's video, we're going to be talking about alcoholism during the TMS process. With me today, I have Dr. Kevin Murphy. Doctor, can you tell us a little bit about who you are?
Thanks, Kyle. I'm a board-certified radiation oncologist and specializing in pediatric and adult brain tumors. And recently, in the last 10 years, have developed a approach to personalizing TMS therapy.
Doctor, when somebody's drinking alcohol while doing TMS therapy, what are the effects of that?
Well, I would say that all of our patients come to us practically on a list of medications. They're using self-medication, including alcohol, just about all of them.
Right. So
we don't change anything we are doing or planning when we treat patients based upon their current use. In standard TMS, alcoholism, and if they're going through withdrawals especially, is a contraindication because you lower the threshold for seizure. You can have people, and so TMS, standard TMS, it's a mild contraindication if someone's either an alcoholic or has active alcoholism or is in withdrawal. In personalizing the dose with PRTMS, we don't have that problem. We can treat right through medications and also alcohol because our threshold for seizures is markedly reduced by giving a lower intensity field. So we don't get anywhere near the motor sensory threshold that could cause a seizure.
Okay.
So we treat patients daily who come in. And what you find is that if they are self-medicating, they start to reduce their own self-medication without us asking them.
Okay.
Well, they'll just need less alcohol and they'll find their cravings are going down. So that's been a common experience of ours, that by personalizing our dose and giving these patients a chance to get treated while they're still going through the process, that they start to medicate less.
So personally, you once told me you are not going to like the effects that you're getting from the alcohol.
Did that happen? Did that happen?
That's exactly what happened.
So if you fix the brain electrically,
right,
then the response to those medications, or alcohol in this case, aren't the same. You don't need 4 drinks to have the same benefit. You might just take 2 drinks and go, I'm there. I don't need to have more. And you might say, matter of fact, I don't need anything at some point. And that's where we got you.
Well, in my case, I was what we used to call purpose drinking. I was drinking to get hammered, to get drunk. That's where I was in my life at the time. Where it would take me a bottle to get to that point. One morning, which you did tell me would happen, I had 1 drink.
Yeah.
And I was way past that bottle effect.
Yeah, that's how it starts. Most of our, and this is true of other medications for pain management, a lot of our pain patients that take narcotics will just say, I'm skipping my dose halfway through the day. I'm not needing it as much.
Right.
And so if you take away the anxiety associated with pain, they don't want to medicate as much. So patients are self-medicating because the system's not working.
Right.
The brain's not where it's supposed to be, and they're trying to find something to get their hands on to fix it. And it's a reasonable approach. It's not working, so what can I do to fix this?
Yep.
And a 40 at 7-Eleven is pretty easy to get.
Yeah.
And that's contemporarily a 40. I'm old. I'm giving my age.
Yeah.
They still have 40s? I don't even know.
They still have 40s, I would imagine.
So, whatever they get their hands on, and you see self-medication go up with people that have access.
Right.
So my 7-year-old and 8-year-old kids don't have access. When they hit 12, 14, 15, you start seeing self-medication because they can get their hands on things.
Yes.
But they're doing that because the system isn't working correctly. And so they're trying to do what they can do to adjust their own system. And what we're saying to them is, let us tune the system first. And then you'll tell me you don't require
those substances.
You won't need them. And if you do take them, then it will make you feel worse, not better.
Which is exactly what happened to me.
And the problem with addiction, particularly, is if we don't fix the brain pattern, then the self-medication was not going to stop because temporarily they are feeling better by a stimulant or a suppressant.
Right.
But if I were to fix the brain pattern, that craving for those things then starts to go away.
Yeah.
Because now those medications have a paradoxical effect.
Okay.
They create an opposite effect. I don't need stimulants now because the brain's already sped up.
Right.
Now stimulants cause me to be jittery.
Right.
Before it was to help wake me up.
Mm-hmm.
Same thing with a sedative. I needed sedatives to bring myself down.
Yeah.
But now the system's brought down already. So now sedatives make me feel heavy and slow too quickly. So the dose starts to be minimized in these patients. The frequency of their use starts to go down on their own.
Which takes away the cravings and all of it, the want, the need of it.
Yeah, you're fixing the problem. The source of the problem is the brainwave pattern.
Thank you.
The sort of addictive personality or the brainwave pattern. In many cases, I would want to be self-medicating too if I had some of the brain patterns I saw in my patients. And I tell them that, hey, it's not your fault. Let's look at your brain pattern. It's telling you how you're going to behave.
Yeah.
It's asking for you to fix it somehow. And you're looking for ways to do that, whether it's going to be through prescription medication or through self-medication.
Yeah.
Our goal is to say, let's tune the system and then decide whether you really want that medication anymore. And patients will selectively use less.
Yes, yes. Well, I was kind of forced to use less. But
Hey, guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.